Melbourne, Australia is facing an outbreak of Legionnaires' disease, and millions are being warned about the spread. Health authorities have issued an urgent warning about the dangerous disease following the hospitalization of multiple individuals with severe symptoms. Victoria's Department of Health is currently investigating an outbreak of Legionnaires' disease after noting a significant increase in cases across Melbourne since Friday. In the past 3 days, there have been 22 confirmed cases of the disease, with another 6 suspected cases. This outbreak is a reminder of the importance of being aware of Legionnaires' disease and taking steps to protect yourself. People who have visited Sydney's Central Business District recently have been warned to be alert for symptoms of Legionnaires' disease as the situation is being closely monitored. But what exactly is Legionnaires' disease? How can it be contracted? Can it be fatal? And what must you do to protect yourself and your loved ones? Legionnaires' disease, named after an outbreak at a conference of American Legionnaires in 1976, is a type of pneumonia. It is caused by bacteria called Legionella. These bacteria are found naturally in damp environments, water sources like lakes and rivers. The 2 most common types in Australia are found in water and soil. They can also contaminate man-made water systems. This includes cooling towers, hot tubs, and plumbing systems. When a person breathes in small droplets of water contaminated with Legionella, they can become infected. This is why outbreaks are often linked to contaminated water sources. Legionnaires' disease cannot be spread from person to person. Legionnaires' disease symptoms are similar to other respiratory illnesses. They often include fever, chills, cough, and shortness of breath. Some people may also experience muscle aches, headaches, and tiredness, loss of appetite, and diarrhea. Legionnaires' disease can lead to severe chest infections, including pneumonia, and may also affect the liver, kidneys, or heart. While most people recover, the disease can occasionally be fatal. Symptoms usually appear 2 to 10 days after exposure to the bacteria. It's important to remember that these symptoms can also be caused by other conditions. If you develop any of these symptoms, especially if you live in or have recently traveled to an area with a Legionnaires' outbreak, see a doctor right away. While anyone can get Legionnaires' disease, some people are at higher risk of becoming seriously ill. This includes people over 50 years of age, smokers, people with chronic lung disease such as COPD, people with weakened immune systems such as those with HIV/AIDS or cancer, and people who have had an organ transplant. If you are in one of these groups and develop symptoms of Legionnaires' disease, it's crucial to seek medical attention immediately. Early diagnosis and treatment can significantly improve outcomes. Legionnaires' disease spreads through the air when people inhale small droplets of water containing Legionella bacteria. These tiny droplets, often invisible to the naked eye, can be dispersed in various ways. These droplets can be generated by various sources, including cooling towers, hot tubs and spas, decorative fountains and water features, and plumbing systems. Each of these sources can create an environment where the bacteria can thrive and multiply. Cooling towers, which are large air conditioning systems, can become breeding grounds for Legionella bacteria. These systems can spread contaminated water droplets over a wide area, potentially affecting many people. Warm, stagnant water in hot tubs and spas can harbor the bacteria. The warm temperatures provide an ideal environment for Legionella to grow, especially if the water is not properly treated and maintained. If not properly maintained, decorative fountains and water features can also pose a risk. These features can be found in public spaces, parks, and even private gardens, making it important to ensure they are regularly cleaned and disinfected. Legionella can grow in plumbing systems, especially in stagnant water or areas with low disinfectant levels. This can include both residential and commercial buildings, highlighting the need for regular maintenance and monitoring of water systems. It's important to note that drinking contaminated water does not typically cause Legionnaires' disease. The bacteria must be inhaled to cause infection, which means that the risk comes from breathing in contaminated water droplets. The bacteria must be inhaled to cause infection. This is why environments that produce mist or aerosolized water are particularly concerning. Understanding these sources and how they contribute to the spread of Legionnaire's disease is key to preventing outbreaks. The source of the outbreak is still unknown, but investigations are underway to identify its origin. The bacteria is also commonly found in potting mix, soils, and products like bagged potting mix and mulch. While it's impossible to completely eliminate the risk of Legionnaire's disease, there are several practical steps you can take to protect yourself and minimize your exposure to this potentially serious illness. Be aware of potential sources. When traveling or in public places, be mindful of potential sources of Legionella contamination, such as cooling towers near buildings, poorly maintained hot tubs, and even decorative fountains. These can be breeding grounds for the bacteria if not properly maintained. Practice good hygiene. Wash your hands frequently with soap and water, especially after being in public places or touching surfaces that may be contaminated. Using hand sanitizer with at least 60% alcohol can also be effective when soap and water are not available. Good hygiene is a simple yet powerful way to reduce your risk. While the Australian Public Health has not advised wearing masks, wearing one can provide some protection. It will reduce the amount of aerosol getting into the lungs. Maintain a healthy immune system. Eat a balanced diet rich in fruits, vegetables, and lean proteins. Regular exercise helps keep your body strong and resilient. Additionally, getting enough sleep is crucial for your immune system to function optimally. A healthy lifestyle supports your body's natural defenses against infections. By following these simple yet effective steps, you can significantly reduce your risk of contracting Legionnaire's disease. Awareness, good hygiene, avoiding harmful habits, and maintaining a healthy lifestyle are key to protecting yourself and those around you. If you experience any symptoms of Legionnaire's disease, especially if you belong to a high-risk group or have recently traveled to an area with an outbreak, seek medical attention immediately. Early diagnosis and treatment are crucial for improving outcomes. Do not delay seeking medical care if you suspect you may have been exposed to Legionnaire's disease. Timely intervention can make a significant difference in your recovery. Public awareness is crucial for preventing and controlling Legionnaire's disease outbreaks. By understanding the disease, its transmission, and prevention measures, individuals can take steps to protect themselves and their communities. Educating the public about Legionnaire's disease can empower individuals to make informed decisions about their health and well-being. Thanks for watching. Like and subscribe for more informative content.